Good afternoon, everyone. This is Saura Arakelian, your clinical pharmacist. So, another summary on the new hypertension guidelines that just came out in August 2025. I want to go over some of the other summaries. In my previous video, I covered a bunch of the summary changes. And in this video, I want to mention another 5 of them here listed. So, one of the things they mention in the new hypertension guidelines, and I've included the link over here that you can access, includes the high blood pressure is the most prevalent and modifiable risk factor for the development of cardiovascular disease, obviously, including coronary artery disease, heart failure, and AFib, stroke, dementia, and chronic kidney disease, and all-cause mortality. So the overarching blood pressure treatment goal of less than 130/80 for all adults, with additional consideration for those who require institutional care, have a limited predicted lifespan, or are pregnant. So they emphasize on the main blood pressure control of less than 130/80. Clinicians should collaborate with community leaders, health systems, and practices to implement screenings for all adults in their communities and implement guideline-based recommendations regarding prevention and management of high blood pressure to improve rates of blood pressure control. Also, multidisciplinary team-based care is effective in assessing and addressing patient access to medications and other structural barriers to support the individual patient's needs, and thereby reducing barriers to achieving hypertension control is very important to achieve the goal of hypertension. And this is one of the things they also emphasize on. The blood pressure, also they mention, is classified by the following framework. And normal blood pressure defined less than 120/80, elevated blood pressure 120 to 129, and systolic 80, stage 1, 130 to 139 systolic, and 80 to 89 diastolic, and stage 2 above 140 over 90 or above 90. And lastly, for all adults, lifestyle changes are important, including maintaining or achieving a healthy weight, following a healthy eating pattern, such as a DASH diet, reducing sodium intake, increasing dietary potassium, adopting a moderate physical activity program daily, managing stress, and reducing or eliminating alcohol intake are strongly recommended to prevent or to treat elevated blood pressure. So again, these are the another 5 recommendations that they make in the new hypertension guidelines. Again, I've included the link in this video. For more questions, comment on the video with your questions on these guidelines. Otherwise, you can access the guidelines, the full guidelines, in a PDF actually format online through the link that I provided in this video. Hope you enjoyed this video. As always, stay safe and take your medications.